Hello, my name is Tara O'Leary and I'm one of the physiotherapists at the Great Western Hospital. In this video, I'll be talking about medial epicondylitis, which is more commonly known as golfer's elbow. I'll explain who might get it, why they might get it, and how we treat it.
So what is golfer's elbow? Golfer's elbow is a condition where pain and tenderness are felt around the inside of the elbow, especially with activities that involve bending the wrist or the elbow or gripping. People tend to struggle with activities like carrying heavy shopping bags, opening door handles or jars. Sometimes the pain is felt down the forearm and into the hand as well, and pain is not usually felt at rest. It's helpful to understand the anatomy of the area to explain why the pain is felt. There are many muscles on your forearm that work together to help you bend your wrist and to make your fist grip. These muscles all join together to form a single tendon that joins onto the bony prominence on the inside of your elbow. Golfer's elbow is caused when this tendon becomes inflamed, and this is usually due to overloading the muscles in your forearm. This can be through carrying heavy items like heavy shopping bags, or it can be through lots of repetitive activities like typing. When the tendon is overloaded, tiny tears can occur in it and inflammation can set in, and this is the cause of the pain. So who gets golfer's elbow? Golfer's elbow is actually a very common condition. It affects adults, males and females equally, and is more common in those who are aged between 40 and 60 years of age. So how do we treat golfer's elbow? Well, golfer's elbow does often resolve on its own in time, but to speed up the process, the main treatment is to try to give the tendon some rest. By that we mean avoiding provoking the symptoms. As it's not always possible to avoid all the activities that overload the tendon, we will provide you with a clasp to wear around the upper part of your forearm. The larger part of the clasp goes on the inside of your elbow and sits just below the bony prominence. The clasp should be tightened so that it's snug but doesn't restrict the circulation in your arm or cause discomfort. The clasp should be worn all the way through the day while you're busy and can be removed when you're at rest or at night. You can also use ice packs wrapped in a towel for 10 minutes at a time on the affected area and massage anti-inflammatory gel into the area several times a day. This will help to reduce the inflammation in the tendon. Painkillers such as paracetamol or non-steroidal anti-inflammatories such as ibuprofen may also be used, which you can discuss with your GP or pharmacist. There is good evidence to show that specific exercises help to rehabilitate the tendon. If these exercises are done regularly, most people find their symptoms resolve within 8 to 12 weeks. To perform the exercise, rest your affected arm on the edge of a table or on the arm of your chair, with your wrist bent backwards. Use the unaffected arm to lift the wrist and then let go and slowly lower the wrist down in a controlled manner. Repeat this 10 to 15 times, then rest for 2 minutes. This should in total be repeated 3 times, twice per day. It is normal for the tendon to feel a little sore and tender during and immediately after the exercise, but this should improve over time. If the exercise is easy and pain-free, you can try adding a small weight, which could be a water bottle or a dumbbell, and repeat the exercise in that manner, lifting again with the other hand and lowering down in a controlled manner. After you've completed your strengthening exercises, it's a good idea to stretch out the forearm muscles. You can do this by putting your arm straight out in front of you with your elbow straight and using your unaffected hand to bend your wrist backwards. Hold this position for 20 seconds, then take a short break and repeat 3 times in total. Throughout the course of your 12-week rehabilitation program, gradually increase the weight that you use in your exercises. After this, it's important to consider trying to prevent the condition recurring, which can occur in some cases. To do this, if there was an activity that provoked your symptoms in the first instance, try adapting your technique. For example, if it's racket sport related, you could enlarge your grip or have coaching to improve your technique. Also, make sure that you warm up, stretch and cool down after any activity. The exercises in this video are in the links below. If you have any problems, do consult your physiotherapist, and thank you for watching.